Shirley Nunn's death highlights failures in family care. In 2021, 67-year-old Shirley Nunn and her son Stephen, 50, were found dead in their Middlesbrough home. A new investigation has now revealed heartbreaking details surrounding their deaths, details that point to a failure in the care system, raising questions about whether this tragedy could have been avoided. Shirley's life took a devastating turn in October 2021 when she was diagnosed with terminal cancer. What would happen to Stephen once she was gone? Stephen had suffered a life-altering accident at the age of 11, leaving him in a coma and causing severe brain damage. Despite multiple surgeries, he was left with permanent disabilities, including cerebral palsy, epilepsy, mobility issues, and learning difficulties. After her husband's death from cancer, Shirley became Stephen's full-time caregiver, with limited assistance from adult social services. Shirley's battle with cancer was swift and aggressive. Diagnosed with stage 3 lung cancer, the disease soon spread to her brain, spine, and pelvis. Despite her declining health, she continued to care for Stephen at home. A domestic homicide review later revealed that Shirley had been struggling with depression and suicidal thoughts, yet critical opportunities to provide her with mental health support were missed. The severity of her illness should have ensured immediate attention to her psychological and care situation, but the urgency of this was not fully understood by professionals, the report stated. 2 days after being discharged from the hospital, police were called to Shirley's home by her sister. There, they found both Shirley and Stephen dead exactly 2 years after her husband had passed away from cancer. A heartbreaking decision that raises difficult questions. The investigation concluded that Shirley had always prioritized her son's needs over her own. In her final days, she may have felt there was no viable plan in place for Stephen's future and saw no other option but to take matters into her own hands. This devastating case highlights the urgent need for better support systems for caregivers. Could this tragedy have been avoided with earlier intervention? Are we doing enough to ensure that individuals like Shirley don't feel like they have no way out? Shirley's story is a painful reminder that while physical illnesses are often addressed, the mental and emotional burdens of caregivers are too often overlooked. It's time to ask, how can we do better?